Hi, good afternoon. My name is Janet D'Souza, off-campus student of University of New England, and today I'm going to be presenting one of the most important organs of our body, the liver. So let's get on with it and see what we do to help our liver and what we do to destroy our liver and cause all the various diseases that most of us struggle with. So here it comes. All right, so this is just a little bit of anatomy. As you can see, we have the hepatic portal vein here and the hepatic artery. The gallbladder is pretty close to the liver. That's right here, which aids in digestion as well. But let's just go to the basic anatomy that we must know. So, the liver is located on the upper right-hand portion of the abdominal cavity. It is shaped like a cone. The liver is a dark reddish-brown organ which weighs about 3 pounds, that is almost 1.5 kilos of your body consists of the liver. Now, the two distinct sources of blood we saw, one was the hepatic portal artery, which carries oxygenated blood, and the vein, which carries deoxygenated blood. But in this case, the vein, the hepatic portal vein, also has nutrient-rich blood. And the common hepatic duct transports the bile, which is made by the liver cells or the hepatocytes, to the gallbladder and the duodenum, which is the first part of the small intestine. Now, there are many functions that the liver has, but just naming a few of them: production of bile, which helps carry away waste and break down fats in the small intestine during digestion; production of certain foods or proteins for blood plasma; production of cholesterol, which when we think is supposed to be something bad, but no, cholesterol has special proteins to carry fats throughout the body, which we need on winter nights, on days when we do not eat. We need the cholesterol. Conversion of excess glucose into glycogen for storage. So the glycogen is stored, and as and when the body needs it during exercise, or even when you've not consumed anything, or when you're fasting, is when the glycogen is broken down again to form glucose. Regulation of blood levels of amino acids, which form the building blocks of proteins. Processing of hemoglobin. Now, this is again very important because hemoglobin, as we all know, it's a part where the liver stores iron, and this iron combines with oxygen to give us the oxygen that we require throughout the body to all the tissues. It's useful also for the conversion of poisonous ammonia to urea. So when ammonia is present in our food, it is excreted by our food in the form of urine through a product called urea, which is excreted. And so many drugs that we take, they have to bypass the liver. They have also got some substances which are not very healthy for the body. Those are excreted. Regulation of blood clotting, that is again very important. Now, continued functions: when the liver has broken down harmful substances, it is excreted through feces in the form of waste, or also in the form of urine, which is excreted by the kidneys. Liver enzymes. The two most important ones are the AST and ALT. And as we know, liver enzymes, or enzymes by the name itself, these are proteins which are found in the body that help catalyze, that speed up reactions by lowering energy. They don't increase any energy. By lowering the energy, they speed up reactions. And the two most important enzymes, as we know, the AST and the ALT, which are the transaminases. So which means they've got some links with the amino acids. Then the functional unit of the liver. We see here these cells, histology slide. They are the hepatocytes, which are major parenchymal epithelial cells in the liver, and they are responsible for a variety of cellular functions, which include carbohydrate, lipid, protein metabolism, detoxification. We definitely need this because the body cannot handle a lot of toxins. We are going to cause a lot of damage to the liver that way, and immune cell activation, just to maintain the liver homeostasis. Now, the hepatocyte functions. Exocrine function is the secretion of bile components, gluconeogenesis, the conversion of amino acids into glucose, detoxification, breaking down of ingested toxins in the form of drugs, deamination, producing urea from amino acids because, like we mentioned earlier, amino acids are quite poisonous. Storage. It stores glycogen, lipids, iron. Now, the conditions that we can have when our liver does not function well: ascites, which we saw in the patient who was 59 years old, who walked into the clinic because she had alcohol overuse for a very long period of time, then developed a fatty liver disease. And what happened in ascites? She had abdominal pain. Yes, we saw that. She had a bloated abdomen because of the bloated liver, which was nothing but the buildup of fluid in the space between lining of the abdomen and the abdominal organs. Now, how does this ascites build up? One of the many causes can be pericarditis, some problem with the heart, or even with the pulmonary system. And what happens is, like, just for instance, you have the left ventricle, the aorta gives or takes blood from the left ventricle and passes it towards the entire body, right to the lower limbs, which require oxygen. Now, what happens is when the aorta, the valve of the aorta is dysfunctional, it pushes the blood back to the left ventricle, telling the left ventricle, hey, look, I know you were kind enough, you gave me the blood, but I'm just full. I can handle your kindness. Please take the blood back. So the blood is given back to the right ventricle gets full, left ventricle gets full, it pushes it to the left atrium and then to the veins. Likewise, if the right ventricle for some reason is full because the deoxygenated blood, the ventricle valve has a default and there is a lot of deoxygenated blood, it goes back to the right atrium, from the right atrium to the pulmonary system. From the pulmonary system, where does it go? To all the organs which gave blood to these pulmonary vessels. And now these organs get full because the pulmonary vessels have said, hey, look, you know what, stomach, spleen, liver, you've been kind enough, but we cannot handle this much blood, so here it goes back to you again. So everything gets bloated and the patient looks full and huge. And you just have accumulation of fluid in the belly, which this patient had, which is why the belly looked big. And because of this, breathing gets into a bit of problem sometimes because the fluid pushes up on the diaphragm, which compresses the lungs and you find difficulty breathing. Treatment, which is almost similar to all the liver conditions, if you may have, avoid alcohol, lower salt, because we know every time you take in salt, water is absorbed also. Now here, there is already enough water, enough fluid. We don't want enough water, right? We want to eliminate it. So we have to limit the fluid intake. We take water pills like the diuretics to get rid of the extra fluid, antibiotics for infections. Jaundice. Jaundice, just by looking at a patient, you know this patient has got jaundice. The very, very characteristic feature is the yellowing of the eye, the skin. We know that the patient, or the nail beds, you know that the patient has got jaundice. Now, if the jaundice happens when you're young, when you're an infant, it's treatable by transfusion, blood transfusion. If you're older, there's nothing much that you can do about it except taking care of your diet and, you know, just lower your alcohol, exercise, good fluids and not fluids which have alcohol content in them. So we have to take care of this because if this jaundice kind of prolongs or aggravates, then we can have gallstones, gallbladder cancer, tumors, and etc. etc. So here, like, you have fever, chills, abdominal pain, changes in skin color, dark colored urine, or clay colored stool. And then the diagnosis, if jaundice isn't caused by an infection, then you have weight loss or itchy skin, pruritus. There is bruising of the skin, spider angiomas. You can see it on the skin, some like lots of spider-like veins. And this happens when you have jaundice. Also palmar erythema. Erythema means reddening. So your palms get red, fingertips get red, and this can be diagnosed by looking at your CBCs, your complete blood count, your urine analysis, much more like liver function tests, etc., etc. Hyperglycemia. Now, hyperglycemia is also not very good. We know glycemia is glucose, it's sugar. This is found in patients who've got diabetes. If it is not treated, chronic hyperglycemia leads to diabetes complications such as nerve damage, eye disease, kidney damage, liver damage, and so many other things. Now, we have seen that also there are certain hormones that we call the stress hormone. Now, when you're under a lot of stress, there is excess cortisol, excess growth hormone, which lead to high blood sugar again. And what does the sugar do? It turns into fat, and we don't need fat cells in the liver. Liver contains hepatocytes, but these are being replaced by the fat cells. And once they're replaced by fat cells, you get this condition called the non-alcohol related fatty liver disease, which leads to inflammation of the liver, the steatohepatitis, or if it's because of alcohol, it's called the alcoholic steatohepatitis. Some of the symptoms of hyperglycemia: increased thirst, frequent urination, extreme hunger, blurred vision, slow healing cuts and sores. We know a slightest cut has to coagulate soon and you get healed faster, your blood stops bleeding, right? You stop bleeding. But in case of people with hyperglycemia, the cuts don't heal very fast. There's an elongate or a prolonged prothrombin time, and it takes a longer time to heal or to clot. Fatigue, there's a lot of fatigue in these clients. Now, prolonged prothrombin means that the blood is taking too long to form a clot. This is because of vitamin 7 deficiency, which is again a factor that is all due to coagulation, which the liver helps in, but in this case, the liver is really not helping. So last, we have the hepatic encephalopathy. What happens in hepatic encephalopathy? The liver gets large. It's the end stage of disease where the toxins have gotten so much in the body, and because of this, there is confusion, there is slurred speech, there are tremors, all that we saw in Mrs. Fender. We also saw that Mrs. Fender had coordination issues. She couldn't stand up or sit down properly. And again, we can blame this all on her continuous or prolonged use of alcohol. Even though she knew what the condition was, she did not stop alcohol consumption, and that is what alcohol did to her. So she was confused, her brain got swollen, she was irritable, she was aggressive, there was a lot of ammonia, which is a toxin which entered the bloodstream, and now she could not be helped. So just to keep these things in mind, that a little too much of alcohol, a little too much of fat, a little too much of salt is all very, very bad for your liver. So take care of your liver, take care of yourselves. It's just one liver you have. There cannot be any transplant done with this liver. So save yourself, be good to yourself, and save your liver. Thank you and have a great day.